Welcome to the Gynarchy Podcast. This is your host, Dr. Gynarchy Patel. Here we place women's health and feminism front and center where they belong, engaging in conversations that range from the fundamental to the fearless. With insights from expert guests, we aim to break through the barriers of the patriarchy and envision a new world led by the Gynarchy. So let's get started and dive right in. Welcome to the Gynarchy Podcast. This is your host, Dr. Gynarchy Patel. And today we're talking about healthy sleep for women with Dr. Angela Holliday-Bell. Dr. Holliday-Bell is a board-certified physician, certified clinical sleep specialist, and author of Sleeping on the Job. She is the founder of The Solution is Sleep, where she helps busy professionals, parents, and corporate leaders improve their health, performance, and emotional well-being through evidence-based sleep strategies. Drawing on her medical training and personal journey overcoming insomnia, Dr. Holliday-Bell empowers people to prioritize restorative sleep as a foundation for success, resilience, and longevity. She is a sought-after speaker, media contributor, and trusted voice in the fields of sleep health and workplace wellness. Welcome.
Thank you. Thank you so much for having me.
So would you like to share a little anything else about your background or what brought you to doing what you're doing?
Yeah, that was a great intro. Thank you. I think the piece that I want to highlight, aside from all of my medical training, really what brought me to the point of doing what I do in sleep is my own struggle with insomnia that I went through during my medical training. I am someone who's always had a very deep, loving relationship with sleep, I like to say. But as I started to go throughout my medical training, I started to have trouble sleeping, falling asleep, staying asleep. Really saw the toll that it took on my life. I was stressed out all the time. I was anxious. It impacted my relationships and my work. And I realized that I needed to make a change and do something about it. So I started studying everything there was about sleep, volunteering at the sleep clinic in my hospital. Once I started to put those practices into place in my own life and saw how significantly my life changed, that's when I knew I had to help other people do the same thing.
Now, was this in residency, you said?
This was, in residency.
Oh, okay. It's so funny. I have that is a rough time, definitely, for all of us physicians, residency and sleep deprivation. I have a funny experience with sleep deprivation. I actually experienced sleep paralysis once from really bad sleep deprivation. It was kind of terrifying. Basically, you can probably explain better what's happening, but basically you're so dead tired and you're out. Your body is also just, you can't move, immobile, but then you become aware and awake, but you cannot move your body, right?
Yeah. And it can be very scary for a lot of people. Some people have associated like hallucinations almost, or they see things in their room when it happens. So it can be quite frightening, but it really is when you become consciously aware while you're still in REM sleep. So your body is paralyzed, but you're kind of waking up out of that state at the same time. And things like sleep deprivation, certain medications, alcohol, and a list of other things can make that happen more frequently or make the episodes worse.
Wow. Yeah, I didn't know what was going on and I was very scared. But now after that, I read up a little bit on it and I realized it was probably from just really being so tired. Thank you for telling us about your background. I wanted to talk about this topic because, as you and I have experienced, problems with sleep, I think it's just a chronic problem among women.
Absolutely.
Women are overworked, stressed out under the patriarchy. And I think that we are, as a group, chronically sleep deprived. And I think it leads to a lot of health problems. And we don't talk about it enough or treat it enough,
Absolutely.
So I thought, could you speak on that a little bit? Like what the importance of sleep from your perspective and what kinds of health problems that people don't realize it causes? Sleep deprivation.
Oh, yeah. So many things. So first I want to speak on your point of women struggling more with sleep issues. So I call it the gender sleep gap. It absolutely exists. Women are 40% more likely to suffer from insomnia than men are. And then when you take women who have kids, we see more than 50% of women getting less than 6 hours of sleep per night on average. And as you go through perimenopause, menopause, we see a significant increase in sleep disorders. So absolutely the gender sleep gap exists. And it is concerning because sleep is so critical and important for our overall mental, physical health. When it comes to things like controlling your weight, having a healthy weight, sleep definitely helps with that. When you're not getting enough sleep, it increases your risk of subsequent weight gain and obesity. It increases the risk of cardiovascular disease, which, as we know, is the number one killer of women worldwide. So that is a very important connection to highlight. Even your risk of infection, right? So you literally are more likely to get sick when you're not getting enough sleep because short sleep durations blunt your immune system's ability to mount an appropriate response to an infection and also to prevent the infection from happening in the first place. When we look at things like mental health conditions, anxiety and depression, if you have insomnia, your chances of going on to develop depression and anxiety increase by 10 and 17 times, respectively. So there's such a huge connection between how you sleep, how much you sleep, and some chronic health disorders that we're seeing, particularly those in women, and a lot of people don't make that connection.
Yeah, I think people will be surprised at this list of, and I bet this is just the tip of the iceberg, this
Oh,
list that
absolutely.
that you mentioned here. Yeah, I think like the infection one, I didn't think about that, but you're right. It affects your immune
Mhm.
system. That makes a lot of sense.
Yeah.
So yeah, gender gap. I agree. That's what I see. I mean, I just take care of women, but that's what I see, that women are really just shortchanging their sleep so
Yeah.
much to be able to get it all done. But there's probably also a gap based on ethnicity or race and socioeconomic status, right? Do you know about that a little bit?
Absolutely. Yeah, so I call that the sleep disparity. So there absolutely is a disparity in the quality of sleep and the quantity of sleep in specific minority populations, African Americans being affected the most, and then as well as Hispanic people of Hispanic heritage as well. We see that African Americans in particular are less likely to get the sufficient amount of deep, slow wave sleep, which is a restorative sleep that we say, generally speaking, is really restorative for the body, replenishing the body's energy stores. They are less likely to get that and more likely to also have sleep deficiency. There are so many factors contributing to that. What we have seen in the research are things like experiencing microaggressions, particularly in the workplace and in the home environment, can contribute to that. Things like us, like you said, socioeconomic status, the neighborhoods that you live in, access to care. Like there are so many things that affect it. I also think there's a long rooted history of a rest deficiency, particularly in the Black community, dating all the way back to slavery, where there were actual pictures of slaves, and if they were sleeping, they were thought to be lazy. And this mindset that was instilled that if you sleep, you're lazy and you have to hustle. And so there are so many different factors, but a lot of it comes down to some things we can't control, but also mindset around what it means to sleep and rest and the privilege that comes with that. And is that okay? So definitely multifaceted.
Yeah, and do you find, I mean, I think definitely, I mean, it just sounds like an overall higher stress load among, in that group of patients. And do you find like there's cultural differences with, how people regard sleep? Like, are there certain cultures that respect it more than others?
Absolutely. So if we look at some cultures that are not in the USA, but more Hispanic cultures, they have siestas, right? So there are middle of the day breaks where everything shuts down, everyone takes a break. It is often used to sleep, although you don't have to, but it's the idea that you just rest, right? Everything doesn't have to be open 24 hours a day or all throughout the day, and it is accepted that that's okay. Some Mediterranean communities as well, and what we see in research is those communities tend to live longer and have less chronic diseases. There are other things, of course, that factor into it, like the meals that they eat and being active, but part of that undoubtedly is because they take the time to rest and they value rest more than us who feel like I'll sleep when I die. You got to hustle. Of course, we can't close for 2 hours during the day. What's going to happen to business? Where for them, it's just accepted that of course you close. Of course you step away. Of course you spend time with your family, you rest. And we do see that reflect in some of the health challenges that we have here versus there.
Yeah, we do have this workaholic culture here. So that's something that definitely probably should change. Let's talk about let's just start with the basics. Like, what would you say is the amount of sleep that people need, and how do you define healthy sleep?
Yeah, no, that's a great question. So the average amount of sleep that a US an adult should get, I should say, is somewhere between 7 to 9 hours. But what I always say is that's just an average, and your sleep need is an individualized number. So it really is important for each individual to determine what that number is for them in order to perform at their optimal level. For example, I need 9 hours of sleep. I know this for a fact. This has been tested. 7 hours for me, not going to cut it. I'm still pretty tired. 8 hours, I'm okay, but certainly not functioning optimally. So it was important for me to determine what my individual sleep need is. I think there is some guilt and shame around needing more sleep than others. So that like, oh, 9 hours, how could you ever sleep, 9 hours? And so some people will shoot for the lower end of 7, even if that doesn't meet their needs. So I always recommend that you determine what your individual sleep need is and try to shoot for that number. And then also understand that when it comes to sleep, quality is more important than quantity. So having consistent, good sleep where you're getting into those deep stages, the slow wave sleep, the REM sleep, cycling through beautifully is going to contribute to you feeling more rested and performing optimally, even if you're not getting quite the number that you need.
Okay, girl, I love that you're getting 9 hours of sleep. And you're a new mom, aren't you?
I'm a new mom. Yeah.
I love it. We need this culture to spread. I love sleep myself. I can't make it 9 hours, but I love to, like, after residency, especially once you've experienced sleep deprivation, and then those babyhood years, infant years when you're up and feeding. Like I like to joke, like, oh yeah, sleep is my boyfriend. I love sleep. But yeah, I like that you prioritize it. I mean, I have so many questions about what you just said. Like, how do you know how much sleep you need? How did you
Great
figure
question.
that out?
Yeah. So I always tell people we need to start with the definition of sleep need because I think a lot of people misunderstand what that is. So it's the amount of sleep that you need to wake up feeling refreshed, able to complete your normal activities with adequate energy and alertness without requiring alertness boosters such as caffeine. Put that part in there
Oh.
because, and I say require, right? I always say I love coffee. It's actually, it's one of the greatest loves of my life. But I don't need it to get through my day, right? For me, it's a joy. It's an addition. If I don't have coffee, I'm also still fine. A lot of people will say, oh, I can make it off of 6 hours as long as I have a couple of espressos, the last one at 12. I can make it to 5. Like they need these additional things. And that means you're probably not meeting your sleep need. And so if you don't know what that number is, though, even though you know the definition, I recommend taking a sleepcation, is what I call it. So a vacation that is surrounded solely on listening to your body's needs and determining what your sleep need is. You set aside about 5 to 7 days, allow yourself to fall asleep and wake up naturally. So no alarm clock. You'll be sleeping off sleep debt for the first few days, which is why it's important to have it be a little bit longer. But generally after that, people find that they're falling into a rhythm, falling asleep naturally, waking up naturally at the same time. And that is typically reflective of what your sleep need is.
I love that. I'm going to try that on my next vacation. So so what do you think about these tools? I got everything on today, the Fitbit, I got the Aura ring. Do you think those are good tools to figuring that out?
They can be helpful. They should be used with some caution, though. So I personally have an Aura ring as well. I love my Aura ring, but I do use it responsibly. I think they are so great in calling people's attention to their sleep, right? For so long, we just ignore sleep altogether. And so having something that says, hey, you might want to start winding down because it's getting close to your bedtime, or what happened yesterday because your sleep wasn't too great, and really getting people to think about their sleep and trends surrounding it, I think is beautiful. What can be a little less helpful is when people scrutinize all the minutia and the details that exist within them. particularly for things like sleep stages. So there's this obsession with getting enough REM sleep and the other stages, but these devices really aren't that great in delineating those stages. So for people who obsess about it, the data is not super accurate anyways. And for some people, it can cause them to become more anxious about their sleep and actually impact their sleep in a negative way because they're scrutinizing the numbers and they're trying to reach this perfect sleep. And so you really have to use it with caution. I say use it for trends, but don't overemphasize like the data and the minutia and all those things.
Don't get too granular about it. Exactly. So I actually do want you to go over like the different stages of sleep and, why they're important and, maybe, I mean, you may not know this off the top of your head, but I bet you do, which is like about how much you need in each stage.
Yeah. So we'll start with the lighter stages of sleep. So first of all, there are 4 distinct stages. Okay, let me start with REM sleep. So REM sleep is more of like the active sleep, and then you have the lighter 3 stages, or the lighter 2 stages, and then the deep stage of sleep, which is in 3. So in 1 sleep is your lightest stage of sleep. This is when like you're falling asleep, but you may not even know that you're asleep. You kind of wake up or you open your eyes and like, was I asleep? That kind of very light going into the first stage of sleep is in 1. You spend a very short amount of time at like 5 to 10%. A little bit deeper is in 2 sleep. So that's when things start to slow down, like your respiratory rate starts to slow down, blood pressure starts to drop a bit, you're getting deeper into the stages of sleep, and you actually spend majority of your time in this stage. In 3 is your deepest stage of sleep. So this is that slow wave, deep sleep. Like I said, if we were to generalize it, this is going to be the stage that's most restorative for your body. And you spend about 20% of your sleep in this stage. And then you have REM sleep, which is the state that most of your dreaming occurs in, although you do dream actually in other stages as well. And you spend about 25% of your sleep in that stage. Generally speaking, we say that's going to be the most restorative for your mind. Again, very general because different stages are going to have other functions. But when we think about your learning and your memory and all those things, we really think about REM sleep, and we think about restoring your muscles and repairing tissues and things like that. We think about the N3 slow wave sleep. And then we have the N2 that's a little bit lighter, and N1 is the lightest.
Okay. So like when you're short on sleep, right? Like someone says they function with 6 hours, 5 hours, 6 hours. What are they cutting out? Is it a little bit of all of them, or which really takes the big hit?
That's a great question. It's a little bit of all of them, right? So there's not like one stage of your sleep that you just take from, if that makes sense. Mm-hmm. Conversely to that, when people say, oh, how do I get more REM sleep, or how do I get more deep sleep? For the most part, meeting your sleep need is going to help you get more of each of those stages, right? So if you need 9 hours, but you're only getting 6, in order to get more REM or deep sleep, you need to try to get 9 hours of sleep. With that being said, there are things like exercise has been shown in research to increase slow wave sleep. So that's going to be important. There are certain medications and alcohol that impact REM sleep in particular. So cutting out those things can be helpful. But generally speaking, I tell people to try to reach your total sleep need. The other thing is your body is very intelligent in the way that it distributes your sleep stages. So if you are sleep deprived, it will actually try to compensate by increasing REM sleep the next day. We call it REM rebound. So your body may say, oh, we didn't get enough sleep. Now we need to spend more time in REM. But you don't really have control over that, right? It's your body deciding, okay, this is how much sleep we need to, put into this stage because of how sleep went last night or the day before. So really just try to meet your sleep need.
Okay, that's interesting. So yeah, I know, I've read, of course, about this, like that you need 7 to 9 hours. And so I know this is not a medical consult, so I apologize for asking you a question about my personal problem, but I think it's a common problem, which is that I can make it, like, I don't know, I get solid sleep. I fall asleep and I get solid sleep for like 5 hours, but then I'm up. And then I got to fall back asleep. And then because I know that it's important to get sleep, I can fall asleep. It takes a while, but then I fall back asleep and then I get a couple more hours. So is that called quality sleep, or is that not as high quality?
Okay, so it depends. I want to first start by saying that it is totally natural and fine to wake up throughout the night. People have
Yeah.
this myth that you're supposed to just stay asleep 100% of the time, never wake up, and that is what healthy sleep is. But that's actually not true. As we cycle through the sleep stages, like I said, N1, N2, N3 REM, N1, N2, N3 REM, you have little breaks in between where you do wake up. So sometimes you don't remember waking up. You may adjust your covers, fluff your pillow, turn around, but that is a brief awakening. An awakening in and of itself is not a problem. That's natural as we go through our sleep stages.
Okay.
What becomes problematic is when you stay awake and can't fall back asleep.
Mm.
Sometimes just the act of being awake makes people not able to fall back asleep because they're so concerned that they are awake. And when I try to calm that anxiety by saying, hey, if you woke up, that's okay. That's actually natural. That's fine. You can wake up as much as 5 times throughout the night as you're cycling through. If you have a normal 8-hour sleep cycle, that's okay. Just relieving some of that anxiety is helpful for them to fall back asleep. So as long as you're falling back asleep within 10 to 20 minutes, that's actually totally fine. That's not abnormal.
Okay, that's cool. What do you think
Mhm.
about people who say, they're chronically sleep deprived, like I described, like they're getting 5 hours and then running on coffee? Like, what about people who I'll just catch up on Saturday, I'll catch up on the weekend? Is that good? Does that work?
No, it's not good and it does not work.
Oh,
So we say you can't. So there have been some recent research articles that say, hey, actually, you can catch up on sleep and there's a decrease in certain incidences of heart attacks or something like that. When you really dig into that, that's like comparing people who had really, really short sleep during the week, like 4 hours or less. And then yes, if you're going to sleep
mhm.
more on the weekend, that's going to be helpful than having 4 hours every single night. But if you are partially sleep deprived and you're only trying to catch up during the weekend, what larger studies have shown is that that's actually not great for your health. Sleep has its own individual functions for each night. So as I mentioned, if you're sleep deprived, the next night your body may try to catch up with the REM rebound. If you're sick, your body may spend a little more time in that restorative slow wave sleep. You can never recover those functions that sleep would
Mm.
have had for that night. The other problem is when you spend this time yo-yoing between short sleep and long sleep, your circadian rhythm never falls into a true rhythm. So you make it harder for yourself to fall back asleep as you start the work week again, for instance. And it's just this cycle that is not healthy. So you still have a risk of all of those chronic conditions that I talked about if you're sleeping longer on the weekends, but skipping on sleep during the week.
Okay, so you really want to try to get to a healthy pattern, daily, nightly pattern. So, what about naps, though? It sounded like you were pro naps.
Oh, I'm definitely proud. Naps are one of my favorite things to do. I love a good power nap, especially in the newborn period. You kind of live off naps, but you do have to nap responsibly, is what I say. So a good power nap can be great to improve your mood, your motivation, mental clarity, creativity, so many benefits. But what that means is a short nap, no more than 10 to 30 minutes, because if you nap longer than that, you run the risk of
Oh,
falling into the deeper stages of sleep, as I talked about, like that N3 stage. And when you're awakened abruptly from that stage, you're more likely to experience what we call sleep inertia, which is a groggy, disoriented feeling that can take a couple hours to recover from. So people who say, oh, I don't nap because I feel worse after I nap than before, they usually are napping for too long. The other thing is napping too late. And what that means for most people is after 3 p.m. Because from the moment you wake up, you're building up this sleep drive that just builds up throughout the day that's driving you towards sleep. You want that to be its peak right before you're going to sleep because that is what helps you to fall asleep and stay asleep. If you nap too long or too late, you steal from that sleep drive and you make it more difficult to fall asleep at night. And as beautiful as naps are, and again, I love a good power nap, it's no replacement for overnight sleep. It's like a cherry
okay.
on the sundae.
Okay.
So you don't want to do anything that impacts your ability to fall asleep at night.
Okay, wow. That's a lot shorter than I thought. I am guilty of those rainy day, 2 hour naps. Just being lazy because I don't
Yeah,
know.
yeah.
But okay, that's good to know. I guess let's talk about basic sleep hygiene. I think that's a phrase a lot of people haven't even heard of, and I think it's important.
Mm,
So,
yeah.
what are some basic tips to get to a healthier sleep pattern for everyone?
Yeah. So, first of all, waking up at the same time every single day is going to be the best way to reinforce your circadian rhythm, that roughly 24-hour cycle that dictates when you feel awake or when you feel sleepy. And at the same time, within an hour from day to day is going to be the most helpful. You also want to try to fall asleep at the same time each night, but waking up at the same time is actually more important than going to sleep at the same time every day.
Okay.
Getting natural light exposure. A lot of people don't think about this because when we think about sleep, we only think about what happens at night. But light is actually the strongest factor that influences your circadian rhythm in a way that tells you to be awake and alert. It shuts off your melatonin in the mornings, boosts serotonin, which is helpful for melatonin production at night, and again, helps to reinforce that circadian rhythm. Having a consistent, soothing bedtime routine. So important. And I think most adults miss this. We do it if you have children, but tend not to do it for ourselves. But our brains and our bodies need that transition point to go from the stress of the day to the relaxation of the night, right? So just 30, 45 minutes, soothing, relaxing routine. If you're really stressed or anxious, finding a way to deal with that. So that could be a brain dump, it could be a sleep meditation, something like that. Just a way to ease your worries and your stress. And then lastly, keeping your space dark, because I already mentioned light is very stimulating, cool, because your body temperature has to decrease by 1 to 2 degrees to facilitate the transition to sleep. You want to keep it either quiet or with a continuous soothing sound, like a white noise. And then you want to think about clutter in your space too, because physical clutter can cause your brain to be active and think about things that are undone as you're trying to fall asleep.
That's a good point. Yeah. Yeah. So that kind of thing really interferes with going to sleep sometimes if you have things on your mind, like clutter you're saying. But so what tips do you have for people like that who have trouble falling asleep? Maybe they have overactive minds. You gave some tips here. Any others?
Yeah. So the biggest thing, if you have racing thoughts that really keep you up, which I think is common, especially for women, I think we tend to have so much on our minds. We're juggling house duties and work duties and caregiving, is to do a brain dump, I call it. So literally sitting down sometime in the evening, well before your bedtime routine is the key here. So after dinner or when you get home from work, and just writing down all the things that come to your mind, like no gatekeeping, just let it flow and put action steps next to it if it requires one, right? So if you have a big presentation coming up at work, you can literally say, tomorrow I'm going to work on the outline. The next day I'm going to start the presentation. The next day I'm going to prep, whatever, because that gives your brain a chance to actually process these thoughts so that it doesn't feel the need to do so as you're trying to fall asleep. Because most of us go throughout our days so distracted that we don't actually have time to process our thoughts. So when all the distractions of the day are gone and you're in bed, your brain's like, okay, now let's think about every single thing we didn't get a chance to think about during the day. So that allows yourself to process those thoughts so you won't have to do it at night.
Okay, what a great idea. I love that. So I have heard of a version of that, like for people who wake up at night, like, and you can't fall back asleep, like to keep a notebook on your nightstand, because I think sometimes that will keep you up, like because you think of something and then you're like, I got to remember this. But if you just have somewhere to write it down, you can maybe get it offloaded and then go back to sleep, right?
Exactly.
Okay, so another question I have, what are the most common reasons that you find people are having like sleep issues? And you can go into like medications and medical problems as well. What are the big things that you're often tackling with people?
So the biggest thing I tackle, so I deal with behavioral sleep issues, so chronic insomnia usually, and at the root of it, it really comes down to an anxiety surrounding sleep, increased stress and anxiety throughout the day, but also when it comes to sleep itself. I know when I was going through my sleep issues, and most people who have gone through sleep issues, when you struggle to sleep for so long, and you know it's something that you should be doing and you want so desperately to do every night, trying to sleep in and of itself becomes a battle. So as you get prepared for the night, you're like, oh, here we go again. Not going to be able to sleep. I'm tossing and turning. And you build up this sleep anxiety. And so for a lot of people that I work with, we have to break that anxiety surrounding sleep. Sleep is a passive process that you should go into without even having to try, really. And so the more you try, the more difficult it is. So it's rewiring the brain to connect sleep with this soothing, relaxing, easy process as opposed to the struggle every night. For some people, though, they have sleep disorders, right? So things like obstructive sleep apnea, where you literally are not breathing or getting enough oxygen to your tissues at night, definitely impact sleep quality in particular. Things like restless leg syndrome, especially as you go throughout pregnancy, or children tend to have that as well. Sometimes they coexist though, right? So sometimes people will have a sleep disorder, let's say like obstructive sleep apnea, they start getting treated and they're like, oh, I'm still not sleeping. And that's because of the struggle that was associated with the sleep apnea, they built up anxiety around sleep. And now it's a little bit of both, right? Now we have this chronic insomnia on top of the sleep apnea. So it can be a mix, but I'll say by and large, the biggest thing is the anxiety and stress surrounding sleep.
Okay. And I guess this is an opportunity for me to say, if you're having sleep issues, I do think it's a good idea to go see your primary care and see if you can
Please.
do a workup, like even like I personally have a thyroid problem that actually, for me, it caused excessive sleep. Maybe that explains the 2-hour naps.
Yeah, but
anyway, I'm better now, much better. I don't fall asleep within the first minute of every movie. Okay, so I also wanted to, so you mentioned, since we're on the topic of hormones, actually, I thought that would be interesting to talk about in terms of, girls and women's journeys throughout life, and like how the changes in our hormones and, times of life, like prepubescent and once you're having your periods, and then pregnancy and postpartum and menopause, like how are all of these affecting sleep, and what are some things to think about?
Yeah, unfortunately, as you mentioned, there are so many stages in a woman's life where her sleep is disrupted, generally related to hormones, but also other things that come along with that. Really, that dates back to puberty, right? So when you go through your menstrual cycle, you have the decrease in progesterone. Progesterone is actually a very important hormone for sleep. And for some people, they have the symptoms surrounding their menstrual cycle that make it more difficult to sleep. And so those alterations for some women occur every single month and make it more difficult to sleep. So I always recommend around that time being super, super intentional about your sleep hygiene and setting up a space that's conducive to sleep. Because for some women, right before their menstrual cycle or during their menstrual cycle is going to be a challenge. Things like pain overnight, bleeding, all those things can definitely impact sleep. The fast forward to pregnancy, and oh goodness, there obviously are fluctuations in hormones around that time. There's a physical discomfort from a growing belly and pressure on the back and pain, things like reflux, heartburn that impact sleep. And then, as I mentioned, you actually do see an increase in sleep disorders like restless leg syndrome and sleep apnea during pregnancy that a lot of people don't talk about or are not assessed for. Of course, it's a difficult time. I think the biggest problem is once you start getting worked up for that, you may be, well into your pregnancy and about to deliver. So timing can be an issue, but really paying attention to your comfort, getting a supportive pregnancy pillow, managing things like reflux proactively. Middle of the night wakings are obviously going to be a problem, right? You're waking up to go to the bathroom, but keeping them as low stimulating as possible is actually really key. So when you're getting up to go to the bathroom, that means not flipping on the overhead lights, grabbing your phone, scrolling through social media a little bit, turning on the TV, because all of those things send signals to your brain that you want to be up and you want to stay up. So I recommend things like motion censored lights that come on so you don't turn on the overhead lights, keeping everything else very dimly lit. Avoid grabbing your phone at all costs. Throw in something like a sleep meditation so it's easier to fall back asleep so you're not continuing to disrupt your sleep. Postpartum, you have the addition of a newborn who's waking up every 2, 3, 4 hours. That's impacting your sleep, in addition to the hormones that continue to fluctuate and the anxiety that comes with postpartum period. Again, the biggest thing there is prioritizing your sleep, understanding that your sleep matters just as much as your baby's. And again, keeping things like night feedings very low stimulating. I recommend using a red light during that time. Not too much interaction with the baby, very business-like. We feed, we put back down, we go back to sleep. Don't grab your phone or anything like that. Lastly, menopause, obviously, we see a decrease in progesterone and estrogen, and we see things like hot flashes that come up that impact sleep. Significant increase in sleep disorders like obstructive sleep apnea that happen around that time. And then life changes, like maybe you're retiring, you're losing family and friends, you have additional medical conditions, medications, so many things that can impact sleep. During that time, I always recommend discussing your options with your medical provider about managing your hormonal symptoms. There are options out there. Speak to your medical provider, see what will work best for you in your life, but also getting assessed for sleep disorders, because again, we see that significantly increase. being very, very intentional about the temperature of your sleep space. So wearing cool, moisture wicking fabrics to bed. There are cooling everything now, cooling pillows, bed spreads, sheets, comforters, everything. Keeping your thermostat low to actually cool off your space is going to be helpful. And then again, really being intentional about your sleep hygiene and managing your sleep anxiety if that's something that has built up at that time.
Okay, so when do you think when is it time to see a sleep specialist, versus just starting with versus seeing your primary care? What would make you think like a doctor like me should refer?
Yeah, that's a great question. So first of all, I think it's never too early to speak to your primary provider about it. I think most people wait way too late. So I say if you're having sleep struggles and you feel that you don't know the answers to them or you've tried things and it's not improved, please start with speaking to your primary provider about it. If you have chronic insomnia, which is defined as difficulty falling asleep or staying asleep at least 3 nights per week for at least 3 months, that's really when it's time to see a specialist. Because again, by that time, it's more of this sleep anxiety than it is just sleep hygiene. And so again, always fine to start with your primary provider. They can often refer you, but that is really when you want to be looking to be assessed. If you feel like you're getting sleep, but the quality isn't there, right? So if you're like, I sleep 8 hours, but I wake up and I'm still tired all day and I have morning headaches, or maybe you have a partner who's told you snore at night, it's time to see a specialist. Getting a sleep study, ruling out sleep disorders is going to be so important. What I always recommend is sleep is a tough issue to tackle within the primary care space, right? There's so many factors that go into how someone sleeps. And when you have a short amount of time to try to address it, it can be difficult. So I recommend people have a visit. If you are struggling with sleep, have a visit just to talk about your sleep. Be specific. Keep track of it in advance if you can. Talk about how it's actually affecting your ability to function so that your primary provider has something to go off of and then can refer you to the appropriate specialist.
That's such a good tip. Yeah, I love that. And that applies to a lot of things because, we are really short on time. So I do think, sometimes when you bring a long list of problems, you're not going to get enough attention for each individual problem, And so I love that idea. Or making, if needed, make more appointments. And now we have telemedicine and things like that. So you don't necessarily have to physically come in, right?
Exactly.
So what kind of tests can you expect? I know you probably can't rattle everything off, and it probably depends a lot on what kind of symptoms people are having, but what can people expect?
Yeah, so just as you mentioned, it really depends on what symptoms people are having. You mentioned your thyroid issue may be hypothyroidism, but I'm sure that came with a lot of other symptoms. So it's fatigue, tiredness can be one of them, and then that may send you down one path. What we do know is things like restless X syndrome can be associated with an iron deficiency. So that is an easy test to do and replace if necessary. But then when it comes to sleep disorders, your gold standard is really going to be a sleep study. So something that is looking at how you're sleeping, what your oxygen levels doing, how your body's moving overnight to determine whether you have a diagnosable sleep disorder that then has a specific treatment. For instance, CPAP for obstructive sleep apnea. There are medication options for restless X syndrome. Sometimes just replacing the iron can do it. Sometimes you need other things. So it depends. There are some tests you can do that maybe contribute, but if you think if we, like a provider, thinks it's a sleep disorder, it's really going to come down to a sleep study.
Okay, so I'm actually just curious, how do you do a sleep study? What does that entail? What does that look like?
Yeah, so your kind of typical gold standard, so to speak, sleep study is in a sleep lab. So it's not fun per se, and most people don't get great sleep during that study. But you come into a sleep lab overnight, you get hooked up to all of these machines that are measuring your brain waves and your oxygen and your movement. You attempt to sleep within the study. There's someone there who's watching, and then they read the results afterwards to determine if you have a sleep disorder of some type. But in more recent years, there's actually been home sleep studies that have come out. So sleep studies that you can do at home that measure similar things. Of course, it's not going to be as in-depth as an in-lab sleep study. It's great because it allows people to have more access to sleep studies. What I caution people with, though, is that it's not great at picking up milder forms of sleep apnea. So if it's like you are pretty sure, your provider is pretty sure you have sleep apnea, it can be great, right? Like for those cases that are almost spot on, it can be great. If it's milder, sleep apnea in women in particular, it can miss some cases. So I
Oh.
say it's an okay place to start, but if you come back, if the results come back and it says everything is fine, but you're still struggling with your sleep quality and you don't know why, I do recommend getting an in-lab sleep study.
So I'm curious, why did you say it's more often missed in women, sleep apnea?
Because women tend to have milder cases and they tend to have cases that don't appear the same as that for a man. For example, when people think about sleep apnea, if I were to ask you, who do you picture when you think about sleep apnea? People usually say, oh, middle-aged, overweight man who snores loudly at night. Typical
Right,
picture.
right,
For
right.
some women, though, they don't even snore and they have sleep apnea
Mhm.
or they're normal weight. This can be the case for anybody, but we tend to just see more atypical cases in women. And
Mhm.
anecdotally, for women that I have managed their behavioral sleep, but who also ended up having a diagnosis of sleep apnea after it being missed, it often just is in women that, oh, I had the home sleep study, everything was fine, but then they actually ended up having obstructive sleep
Mhm.
apnea. So that's why I always say if your sleep quality is impacted, even if you don't snore, even if you don't fit that picture, get assessed because there are so many times that it comes up as sleep apnea, even though it didn't look like that would be the case.
Okay, that makes a lot of sense. I mean, I think a lot of what is considered normal is probably based on men.
Yes, unfortunately.
That's why I do these episodes. Yep.
Mhm.
Like it is kind of funny how literally every topic has an angle that I can talk about because it's so unfortunate, but every little aspect of our lives is, yes, very much affected by the patriarchy. But okay, I wanted to talk about, you mentioned red light, which is
Yeah.
something like I thought it was blue light that you needed to use to be more conducive to sleep. Do you want to
Oh,
explain the whole theory about that and why and what you
yeah,
recommend?
yeah. So there are different wavelengths of light that impact your circadian rhythm differently. So blue light has the strongest impact on your circadian rhythm in a way that is alerting. So I mentioned earlier that light is the
Oh,
strongest factor influencing your circadian rhythm in a way that tells you to be awake and alert. That blue wavelength of light has the strongest effect. So things that strongly emit the blue wavelength are electronics, right? So your phone, your tablet, your computer, the
oh,
television,
okay.
which is why we
Okay.
recommend not using those close to bed.
Blocking blue light.
Exactly.
Okay,
But
right.
blue light is important during the day. So getting out, obviously there's significant blue light in natural sunlight and things like that. We want that during the day. What we have found is that the red spectrum of light or the red wavelength of light has the lowest impact on your circadian rhythm and
Hmm.
is less disruptive to your melatonin production. And in some ways, the research needs to bear this out more. We think it can actually stimulate your melatonin production because it
Hmm.
mimics the wavelength of light emitted by the sunset. So we evolved to align our circadian rhythms with the natural sunrise and sunset.
Hmm.
Of course, we don't live like that so much anymore. But that red wavelength mimics the sunset as much as possible. So when we want to think of light that's conducive to sleep or light that's less disruptive, that's where the red wavelength comes into play. So if you need to use a light before bed or during middle of the night wakings and things like that, that's going to be the best wavelength to use.
Okay, really interesting. Learn something new. I love
Yeah.
that. So, okay, what do you think about melatonin? Like, does that
Mhm.
work? When do you recommend it? Or do you
It
not?
can, yeah, it can work, and I do recommend it only in certain situations. Though I think it is absolutely overused. So melatonin is a hormone we naturally produce, right? It is the hormone of darkness that sets the stage for sleep. There are ways to increase your natural melatonin production, but there are also times that that production is thrown off for other reasons. If you are traveling across time zones and now you're needing to go to sleep earlier than when your natural melatonin would be produced, is one situation. When we roll back the times or do the clock changes, again, we're shifting that schedule. For some people, it's as simple as like going on vacation for a long time and I don't have a consistent schedule that I'm keeping and I'm going to sleep later. And we need to shift that. That's when melatonin can be helpful for short-term use. So it's usually just getting back on track, readjusting your circadian rhythm, low dose as well. So most people don't understand, even as adults, we shouldn't really need more than 1 to 3 milligrams of melatonin, not the 10, 20, 30, 40, 50 milligrams I see some people use.
Okay, okay. So
And then
more melatonin gummies is going to do nothing.
exactly. More is not better.
Okay.
And then there is some research that suggests that people over the age of 65 may actually produce less melatonin. So in those instances,
Hmm.
it may be helpful as well.
Okay. You mentioned that there's natural ways to increase melatonin. What is that? What are those ways?
Yeah. So it comes actually back down to the sleep hygiene rule. So getting natural light exposure
Okay.
first thing in the morning can be helpful, limiting light exposure as you get closer to bedtime. But things like normal overhead lighting, people don't realize, like they think of like their tablets and their phones and things. But there's research studies that show that just like room lighting within a couple hours of bedtime can delay melatonin release by 90 minutes and decrease the total amount you secrete overnight. So really paying attention to how you're utilizing light and dark throughout the day.
Okay. I would love to hear. Okay. One of my bedtime routines is a bath. I love baths. But I'd love to hear your bedtime routine. What do you do?
Oh, yeah. So first of all, I love my bedtime routine. It's something that I'm like, this is my me time, especially now having a baby. This is the time I look forward to. So for me, it starts with dimming the lights. I have dimmers throughout my house, I recommend, or just using low emission lights. I like to play music, like just my calming, soothing music. If I'm really feeling fancy or stressed, and I like some candles as well. I do my skincare routine. So that's when I'm really indulging in all the layers of my skincare. I read a little bit of whatever book I'm reading that night, and I do a devotional actually with my
Oh,
husband, and
nice.
then go to sleep. And yeah, that's my routine.
Okay. So I shouldn't be watching White Lotus right before I shut the lights off. Okay.
Not
I love
ideal.
that. That sounds lovely. That sounds lovely. I need to move my schedule
Yeah,
earlier.
and
Yeah.
I always recommend if watching TV is a part of your routine, that's okay, but just put that at the front of the routine and then do all the other lesser stimulating things after that.
Okay. Well, gosh, this went really fast, Angela. It was really fun talking to you. Tell me what you're up to now. Like, what are you working on now? Do you have any? I know you're busy mom, but I see you on social media and things, and you're probably really busy with your practice. But what are you excited about?
Yeah, so I'm excited about going in. I do a lot of work with actual corporations and companies going in and speaking to their workforce about the importance of sleep. What people don't realize is that when it comes to getting good sleep, everyone deserves it to feel your best, but literally to perform your best, to be productive, even in the workplace, sleep is crucial to that. And so now companies are starting to catch on. So I come in to kind of bridge that gap and help them understand how they can get better sleep so that they can perform better and it's better for everyone. Everyone can bring their best selves to work. That's kind of where my book, Sleeping on the Job, comes in because I literally break down sleep strategies based on your work setting. But I'm also active on social media, Instagram, the Sleep MD, and then I also do some coaching as well for individuals struggling with either insomnia or now for new moms who are struggling with their sleep and their baby sleep.
Do you have another book in your future?
I do. I do. Writing a book is a task. It's a task, but I do, as I am going through my own journey with my baby and really seeing how moms in particular are struggling when it comes to sleep and their baby sleep. I do want to write a book that incorporates both because so much of how moms sleep is impacted by how her child sleep and vice versa. So empowering moms that they also deserve to sleep, giving them some tools and strategies to help their baby sleep so both of them can get the sleep they need.
Okay, that sounds like an amazing book, and I want you back. I want you back after that book's out.
Absolutely.
Um, okay, do you have any closing thoughts for everyone?
Yeah, I think I always like to close with people just understanding that above anything else, you deserve to sleep. One of my favorite quotes is instead of asking myself, have I worked hard enough to deserve to rest? I started asking myself, have I rested enough to do my best work? And I think that when you view sleep with that mindset, it really highlights the importance of it and why you deserve it. And you need to start with filling your own cup, especially as a woman who typically wears so many roles and takes care of so many people. Fill your own cup first with rest and sleep, and then you will be so much better at all your other roles.
Okay, very wise words. Thank you so much, Angela. It's really talking to you.
Yeah,
Okay.
same.
Okay, so this is my closing thought for today. In the patriarchy, women are chronically sleep deprived because of the unequal division of labor, their higher levels of stress and anxiety, the dismissing of women's symptoms like insomnia and fatigue, and the cultural expectations that women should do it all and sacrifice their rest. But in the Gynarchy, we know that sleep is not a luxury, but a vital basic need and a right for all women. And we prioritize women's sleep because we know that the lack of sleep negatively affects women's health, particularly mental health, their emotional health, and their physical health. So down with the patriarchy and up with the Gynarchy. Did you enjoy this episode of the Gynarchy Podcast? Know someone else who might enjoy this conversation? Make sure to subscribe and share the show with your friends and family. Find us on Apple, Spotify, YouTube, and just about anywhere you find podcasts. On social media, we can be found on Blue Sky, Instagram, and TikTok at The Gynarchy. Thank you so much for listening.